Hi everyone, Aaron Brooks with Perfect Postures, and today I'm going to talk about shoulder pain. This is actually take two because the microphone was not turned on. So what I wanted to talk about was a lot of clients come in here with shoulder pain, and quite often they come with a diagnosis of possibly like a bursitis or a rotator cuff impingement. And what we do here at Perfect Postures is not so much, we don't treat symptoms, but what we do is look at mechanics and look at the underlying causes for someone's particular issue. And one of the things I just want to kind of bring to your attention is the position of your shoulder. Now this is important because, I'll use an example, if one shoulder is higher than the other, and that's your symptomatic side, or that's where you're getting the impingement or the rotator cuff injury or the bursitis, then if there's faulty alignment, it's almost impossible for the muscles on this side of the body to be on the same tension, length tension, the ones on the other side, right? So if I go like this, well, this trapezius muscle, this muscle up here, is going to be more taut than the ones on the left side. Now, that's important because as this elevates, and then you ask the arm to move, you're reaching, or maybe you're brushing your teeth, or maybe you're reaching back to grab something or put your coat on. If this is elevated, there's going to be actually less space in the joint. So what typically happens is because there's less space, you actually get more impingement on the tendons that cross over. And in particular, that's your supraspinatus tendon, bursa sac, your bicep tendon could be impinged as well. So if that's what's happening over time, you're going to be having more and more breakdown. Now, a lot of times when clients come in here, we'll go over health history and we'll ask what they've done in the past. And a lot of them say, well, I've been doing the rotator cuff strengthening. That's important to strengthen those muscles. However, if there's a malalignment, again, if this is elevated and you're doing these rotator cuff internal external rotation and some of these lifts or these pullbacks, you're really kind of strengthening the problem, right? So you want to address, or we would address, those malalignments and then maybe go into some of the rotator cuff strengthening type exercises. So I would, if you're experiencing shoulder, just get in front of a mirror, look and see if one shoulder's off, meaning that one's malaligned, or if your spouse or something is having issues, just take a look and see what's going on. So what we're going to do is show you a corrective exercise of the week following this. And it's not going to seem all that complicated of an exercise, but it's really multifaceted. So stay tuned for that. And please, if you have questions, feel free to shoot us an email. Thank you. We'll see you next week.